Right, hi, I'm John Kanellopoulos. I'm an eye surgeon. We're here in our center in Athens, Greece. I'm medical director of this center. We are 8 doctors. And I'm also a clinical professor of ophthalmology in NYU Medical School in New York City, New York, where I spend every couple months, several days in a smaller practice there. My area of interest is, my training is basically in cornea transplantation. I've done fellowship training in cornea transplantation in the US, in Cornell and Harvard. And I've also done a fellowship in glaucoma, also at Harvard Medical School. So my area of interest has been work around the cornea mainly. Complicated cataract surgery, complicated glaucoma, cornea transplantation, and special refractive surgery cases. So that has been the core of my practice and the core of the investigative work that we do here in our center. Our center is 50%, so to speak, clinical. We do routine eye exams, cataract refractive surgery, cornea transplantation, and 50% of our work power and effort goes into clinical research. Despite being a private, small eye center in Athens, Greece, we work a lot in all the parameters basically that are involved in eye evaluation and eye surgery, and that gives us a wealth of data that we have the honor and privilege to work with and being able to significantly share with the rest of the ophthalmic community. So being a small center, we invariably have about 100 to 120 presentations in the 4 major global meetings over the last 20 years. So it's a very large part of our everyday routine here. It's very interesting to think back. I've been in practice now almost 25 years in ophthalmology. Graduated my residency in '94 and then did 3 consecutive fellowships. It's very interesting to think back and see what is your strongest professional achievement. I would probably focus on the fact that I'm able to have a very straightforward practice that enables me to, number one, fulfill my passion of taking care of people, but at the same time gives me the leisure to be able to work with clinical research, which is the flip side of my ophthalmic personality. I'm able to enjoy both aspects, and despite the fact that this gives me some significant academic achievements, I've made clinical professor at NYU, which is now the #3 medical school in the US. I was honored to be the president of the International Society of Refractive Surgery in 2016 and 2017. I would count as #1 the privilege of having a solid practice, having a very good relationship with my patients, and at the same time, this practice to be strong enough to support all our investigative interests. This gives us a huge level of freedom to work with products that are helpful for our patients, on the one hand, and number 2, gives us the ability to have all the diagnostics and all the equipment that makes us better clinicians. Many of the problems that we deal with have a simpler solution, but going into more detail certainly makes you a more astute clinician, and in my opinion, enables you in offering excellence in clinical care as well. It is interesting that through the years, we were probably the second group after Theo Seiler to get involved with cornea cross-linking. And it's also interesting that this happens in a land where keratoconus is endemic. So within the first year, we had 5 or 6 times more patients treated than anybody else in the world. So this created a very interesting cascade for us with significant research that brought in many of the steps that have improved cross-linking, meaning our center in Athens is the home where higher fluence was introduced from 3 milliwatts to 6, 9, 18, and 30. This is the home where it was combined with a topography-guided normalization, what's known now to be the Athens protocol. Other means of cross-linking, in-flap cross-linking in a cornea, its use as a prophylaxis for routine LASIK or PRK. So I think that most people, whenever they think of our center here in Greece, and myself as a clinician, probably picture all this work that we've done and published on basically cornea diagnostics in early keratoconus diagnosis and the management of keratoconus and cornea ectasia with cornea cross-linking. And as a transplant surgeon, I feel privileged that I was able to materialize all this knowledge and research into basically avoiding cornea transplants in young patients. And I think this is a humongous landmark for me as a clinician. I started with cornea transplantation being the only solution for a younger adult who is intolerant to contact lenses and has advanced keratoconus, to now being a very rare occasion that I will do a transplant in such a keratoconic patient. I think this is very gratifying. It's always difficult, having trained in so many places, to think of what has been the stronger influence. I've started medical school here in Athens, Greece, and then I transferred into a medical school in the US, did my residency, 3 fellowships. I think that I was fortunate to benefit from many academicians and clinicians throughout my life. Of course, I would consider the top 3 being Klaus Dollmann, who is the father of cornea, the cornea specialty, probably worldwide. He's either trained directly or indirectly most of the cornea specialists in the world. I was fortunate to have trained with disciples of Klaus, Hank Perry and Eric Donenfeld in New York, who happened to be colleagues after that. We were able to collaborate as professionals after my training, and then go to Boston and train firsthand with Klaus. And I think that that has been a pivoting point in my career, not just as far as the academic knowledge, the investigative bug to want to prove everything that you're doing, that it's actually done for a reason and for a benefit. But I think they've been role models as personalities, in their honesty, valor, their wealth of sharing all this with the ophthalmic community. So I feel very fortunate to have been influenced by these people who I consider my mentors. It's funny that many people outside medicine think that meetings, especially international meetings, are a good opportunity for the doctor to leave the office and have a good time. But now, 25 years later, and almost 2,000 paper presentations later, 150 peer-reviewed literature papers, I'm convinced that for me, the presence and the participation in international meetings has been the most significant school that I have been in. You train, you get your basic knowledge and your basic principles, and it is only through the interaction with your colleagues, all the even tiny arguments in a paper presentation, or learning a new technique from a colleague, or trying to document why your new technique has benefited patients. The interaction with technicians, people of the industry, is a non-stop source of everyday knowledge. By the time things we discuss in a meeting today will reach a journal or a book, it'll be 5 or 10 years later. So I think that medicine has turned into this dynamic exchange of information that is instant and constant. And I feel very fortunate of being part of the international community that is so generous in sharing all the good and bad things that we may encounter, and this makes us more responsible clinicians and definitely more sensitive and accurate in our work. Well, it's true that I do not view my profession as a job, somewhere that I have to go in the morning and then return back to my normal life in the evening. I think that my profession has turned to be a significant part of who I am. I consider my work a hobby. I would do it even if I did not get paid. I feel very fortunate that through my passion in combining patient care, research, interaction in international meetings is able to also provide me with a comfortable living. But I think that on a scale 1 to 10, my profession is definitely the most important thing besides family in my life. I could not imagine myself as anything else. I know it's very interesting how life changes. 35 years ago, I was wondering what I will become when I grow up. And it is through life's pathways, highways, and travels that you reach a point where you think you found the best fit for your everyday life. And I feel very fortunate to be able to live it and keep experiencing it. It's very hard to think myself outside my profession, since I consider my work being my hobby. Of course, we all need some downtime. I enjoy very much living in Greece the last 17 years, the pleasures this country has to offer. In the summertime, we spend a lot of time boating, water sports, sailing. Definitely enjoy doing all these activities with my 3 children. And I think that it's a nice complement to be able to also become physically active and besides being a very busy professional, because that gives you the strength, the physical strength to be able to attain such a busy schedule. So I would rank my number 1 passion, of course, my work, ophthalmology. My number 2 passion, enjoying life in general, friends, sports, and family activities. Through the years, there's 2 main problems that me as a clinician have found very difficult to deal with. And despite the fact that I'm an anterior segment surgeon and a cornea specialist, so to speak, I think the most devastating is macular degeneration and having to deal with patients who are in their 70s, 80s in age, that in our times is an age that people are extremely active, productive, most of them work. They're a very important part of everyday life and society. Although there have been advances, I think being able to cure or prevent macular disease is essential. On the other part, if we go to the practicality of life, and me having had my 50th birthday already, I think presbyopia is the other holy grail of not as devastating as losing your central vision, but being able to access and access near and distance vision at the same time without glasses and without the aid of presbyopic lenses or presbyopic solutions is a tremendous frontier. I've seen so far in my career significant advances, but I think we have ways to go until we reach a level where we can say we've cured presbyopia and somebody in their 50s and 60s is able to work at distance near either their ophthalmologist, either their lawyer, either they're a tennis player without having to compromise. And I think that these 2 areas are things that I'd love within my career, or at least in my lifetime, to be able to see solved. I think that we talked a little bit about a professional career, about passion in medicine. I truly believe now, in the years that I've been a clinician and a researcher, that I concentrate the wealth of my everyday life in 3 areas. Number one, and I think this is the most rewarding of all, is the handshake, the smile on the patients that we're able to offer solutions and help, and the understanding when they see in you all this effort. And this is definitely the most rewarding aspect of our work. The other side, of course, is the ability to academically establish the work that you do as far as its efficacy and its safety. But third, and I'm really very thankful for this, is the large number of colleagues internationally that have been supportive, that have been the stimulation that you need to excel, to work with, to interact, to compete if you may, to argue sometimes. And that is an environment that is a mistake to see just as competition. It's an environment that is necessary for somebody to excel. So I'm grateful for all 3 areas of influence in my life, and I will always be.